Hi everyone! So today we are going to be covering pneumonia epidemiology. This video is going to include a variety of different topics, such as the definition of pneumonia, causes and types of it, as well as how it is transmitted, incubation periods, signs and symptoms, and more. So let's start off with the basic definition of pneumonia. Pneumonia is an infection that can occur in either one or both of the lungs, and as a result the air sacs can fill with pus or other types of liquids. In my opinion, this image, which was provided by the Mayo Clinic, did an amazing job demonstrating the difference between normal air sacs in your lungs versus those that are inflamed and filled with fluid, which is pneumonia. So pneumonia can be caused by a variety of different things, but primarily bacteria, viruses, and fungi. There are different types of pneumonia as well. Lobar pneumonia affects one or more sections of the lungs, whereas bronchial pneumonia affects patches throughout both of your lungs. However, as we will discuss, pneumonia is most commonly caused by bacteria or viruses. So let's talk about bacterial pneumonia. The most common type of bacterial pneumonia is caused by the Streptococcus bacteria. Streptococcus is an extremely common bacteria. Streptococcal bacteria can actually cause a variety of different illnesses, such as strep throat, scarlet fever, and cellulitis. However, this is specifically the group A strep, and you can have a variety of different bacterial infections that end up resulting in pneumonia. In most circumstances, bacterial pneumonia occurs because the body is weakened for whatever reason. This can be due to illness, poor nutrition, old age, or just immune system issues in general. But in return, the bacteria can usually navigate into the lungs and cause this irritation and infection. You also have a higher risk of developing bacterial pneumonia if you abuse alcohol, smoke cigarettes, have recently had surgery, have some sort of respiratory disease or infection, or have a weakened immune system, like I mentioned prior. So now let's talk about viral pneumonia, which can be caused by different viruses such as the flu. It is estimated that influenza infection accounts for the development of approximately 1/3 of all pneumonia cases. In addition, research has also suggested that you are more likely to get bacterial pneumonia if you have viral pneumonia. Next, we have mycoplasma pneumonia, which usually exhibits different symptoms and physical signs and is referred to as atypical pneumonia. However, it is estimated that there are about 2 million cases of this type of pneumonia each year throughout the United States. And this is caused by the Mycoplasma pneumoniae bacteria. And this can cause a relatively mild type of pneumonia that can affect all age groups. And like I mentioned before, other pneumonias can be caused by fungal infections. However, this is significantly less common, especially when compared to bacteria and virus-induced pneumonia cases. Now let's talk about transmission. Since pneumonia is not a virus or a bacteria, it is not considered contagious. However, you could transmit the bacteria or the virus that caused the pneumonia infection to other individuals, so illness can still be spread through respiratory droplet transmission to others through coughing, sneezing, talking, etc. And then these droplets can be inhaled by individuals who are nearby. It is also relatively uncommon for this to be transmitted through surfaces. It is most commonly done through droplet transmission. So what is the incubation period? Well, it varies on a case-by-case basis, and like we've discussed, it can be caused by bacteria, a virus, a fungus, a wide variety of different things. But pneumococcal pneumonia develops in approximately 1 to 3 days on average, and that's according to the CDC. And also, just for reference, pneumococcal pneumonia is considered a bacterial pneumonia. So what are the traditional signs and symptoms of pneumonia infection? Well, bacterial pneumonia includes bluish color to the lips and fingernails, a confused mental state, a cough that usually produces green, yellow, or bloody mucus, as well as fever, heavy sweating, loss of appetite, low energy and extreme tiredness, rapid breathing, rapid pulse, shaking chills, sharp or stabbing chest pain, as well as shortness of breath. Now, most of the time, individuals who suffer from viral pneumonia have very similar symptoms. However, in addition, it can also include headache, increasing shortness of breath, muscle pain, weakness, and worsening of the cough. So now let's finally jump into pneumonia epidemiology. And I found that this was extremely fascinating because I did not know this, but as I was reading into pneumonia from the CDC, I discovered that on a worldwide scale, pneumonia is actually the cause of death for more children under 5 years old than any other infectious disease, and this is on an annual basis. Throughout the United States, approximately 1.5 million people were diagnosed with pneumonia in an emergency department annually, and this number is estimated to have increased since the introduction of the COVID-19 pandemic. So I wanted to provide a list of vaccinations that can actually help prevent pneumonia. There's not one specifically designed for pneumonia. Like I said, it is not a specific virus, but a lot of these vaccines actually stimulate the immune system and they actually produce antibodies that can help fight off infection. So when you're vaccinated against these different things, it can actually help to fight off the odds of the development of pneumonia as well. So it was actually a little bit more challenging to find graphical depictions of different pneumonia cases and deaths, but I did end up finding some on the Our World in Data website. They didn't have any data on the CDC, which I do like to pull statistics from, but this will have to do. So this is all throughout the world. As we can see, the vast majority of deaths are 70-plus-year-olds. However, there is a massive number of under 5-year-old individuals who pass away from pneumonia every single year, and we are actually going to dive into this in a little bit more detail in one of the other graphs that I provide. However, do remember that I mentioned on the first epidemiology slide that pneumonia is actually the leading cause of death throughout the entire world for children under 5 years old. So keep that in mind as we're looking at these numbers. So now I wanted to include data from the United States, and again, this is deaths from pneumonia by age. So as we can see in our particular country, it is 70-plus-year-olds who do have the highest rate of mortality. And actually, if you look at the complete breakdown, you can see that this goes in chronological order of deaths based on age, well, with the exception of the 5 to 14-year-old group. But other than that, the most common group of individuals who is susceptible to die from pneumonia are the 70-plus-year-olds, followed by the 50 to 69-year-olds, and then the 15 to 49-year-olds. But then the under 5s come next, followed by the 5 to 14-year-olds. So finally, I wanted to provide a graph from a least developed country. There are approximately 46 of these throughout the world, but as we can see, the difference in the epidemiology regarding deaths from pneumonia is so drastic. All you have to do is change countries, and what is so fascinating regarding healthcare is that the statistics can change so much. And in this particular circumstance, it is really tragic. And when we look at this, there are a lot of factors that we do need to consider. So as we can see here, the group that has the highest probability of dying from pneumonia in this particular country is the under 5-year-old group. This is almost a complete opposite of what we saw in the United States, which just proves how important access to healthcare actually is. That's it for pneumonia epidemiology. Please stay tuned if you are interested, and the next video that I am making is on influenza.